I recently came across an iceberg covering mental disorders, phenomena, and complexes created by Reddit user lurking000, so that's what I'll be covering in today's video. I just want to preface this by saying that the majority of these conditions are terrifying for the person who experiences it. Most of them do not cause sufferers to become a danger to others. This video is not intended to scaremonger or sensationalize mental illness or disorders, but rather to educate and hopefully raise some awareness of some lesser known conditions that you might not even know exist. Let's investigate. If you enjoy internet mysteries and generally disturbing content, feel free to subscribe and turn on notifications for more content like this. If you're interested in supporting the channel, you can become a Ko-fi member or a channel member to gain access to uncut videos and other perks, or you can leave me a tip by clicking the thanks under this video. Thanks to anyone who considers this. Attention Deficit Hyperactivity Disorder, or ADHD, is a condition that causes symptoms that can be categorized into two types of behavioral problems: inattentiveness, meaning difficulty concentrating and focusing, and hyperactivity and impulsiveness. Someone with ADHD will not necessarily experience symptoms within both these categories, and some people only have problems with concentrating but not hyperactivity. This is known as ADD, Attention Deficit Disorder. There is no cure, and treatment includes medicine to reduce symptoms and therapies such as cognitive behavioral therapy. While most people will experience periods of mild depression at times in their lives, clinical depression is much more serious, and symptoms can last for weeks, months, or even longer at a time. There are many possible triggers, including stressful events like divorce and bereavement, childbirth, alcohol, and drugs. Treatments include lifestyle changes, antidepressant medication, and counselling. Much like depression, anxiety is something that most people will experience at some point, but generalized anxiety disorder is a long-term condition that can seriously affect a person's quality of life. Anxiety is the main symptom in a number of conditions like post-traumatic stress disorder, panic disorder, and phobias. Bipolar disorder is characterized by episodes of depression and mania, meaning moods can swing from one extreme to the other. Each can last for many weeks or even longer. The manic phase can involve feeling overly energetic, making impulsive decisions, and even hallucinations. A phobia is an irrational, overwhelming fear of an object or situation that is classed as a type of anxiety disorder. Common phobias include claustrophobia, a fear of confined spaces, arachnophobia, a fear of spiders, and acrophobia, a fear of heights. Phobias can cause significant anxiety just by thinking about the source of the phobia in some cases, and can cause people to avoid certain situations, which can be debilitating, particularly with complex phobias like social phobia, a fear of social interactions. Autism can affect different people in different ways, and to different extents. Common symptoms include problems communicating and interacting with others, finding it hard to understand how others think and feel, and anxiety related to unfamiliar situations and social events. People with a severe form of autism may be non-verbal or have very limited speech, and may engage in behaviours like rocking, flapping, and jumping. Dyslexia is a relatively common learning difficulty that does not affect intelligence, but may cause problems with reading, writing, and spelling. For example, someone with dyslexia may get confused with letters that look similar, like D and B. Schizophrenia is a type of psychosis that results in symptoms that are divided into positive symptoms, like hallucinations and delusions, and negative symptoms, like withdrawal, lack of emotions, and lack of interest in activities such as social interactions. People with schizophrenia don't necessarily experience symptoms 24/7 and often have episodes where their symptoms are particularly severe. During this time, they may become disorganized and unpredictable, find it hard to keep track of conversations, hear voices, and become paranoid. It's not uncommon for sufferers to start believing that they are being harassed or plotted against by someone close to them, and that people they don't know are communicating with them, for example through the TV or in hidden messages in a newspaper. Most people recover, especially when they receive treatment, but occasional relapses are not uncommon. Obsessive-compulsive disorder, or OCD, is characterized by obsessive thoughts that lead to compulsive behaviors. Perhaps the most common example that people associate with it is related to cleanliness. People may be hyper-aware of germs or contamination of some kind, and this could result in behaviors such as obsessively cleaning themselves and their homes. This is by no means the only way that OCD can manifest. Some people may experience it after childbirth and be extremely paranoid that their baby will become ill or die, resulting in them constantly checking on the baby and not feeling comfortable leaving them with someone else. Other people may experience OCD related to burglary and may feel the need to check all points of entry in their home multiple times before they can go out. Hoarding can also be linked with OCD, which is where a person acquires an excessive number of possessions and finds it very difficult to get rid of them, even when they have no monetary or sentimental value. Seasonal affective disorder is a type of depression that is sometimes referred to as winter depression, as it is linked to reduced sunlight exposure, so symptoms will typically be worse during the winter months. Postpartum or postnatal depression is another form of depression that occurs shortly after childbirth. While many parents will feel a bit down and anxious after their baby is born, if these symptoms are severe and last longer than 2 weeks, they could be a sign of postnatal depression. And in addition to the typical symptoms experienced with clinical depression, a parent might find it difficult to bond with their baby, and in extreme cases may even have intrusive thoughts about harming them. Alcoholism is defined as alcohol consumption that results in significant mental or physical health problems. The term alcoholism is discouraged when it comes to making a diagnosis due to its stigmatized connotations, and a doctor would typically say someone has alcohol use disorder or alcohol dependence. The short-term effects of overconsumption include alcohol poisoning and irresponsible decisions, and consequences of long-term misuse include liver disease, heart disease, stroke, and various types of cancer. Dementia is an umbrella term for various conditions relating to a decline in brain functioning, resulting in loss of memory and problems with thinking and language. It usually affects older adults, and the most common type is Alzheimer's disease. Post-traumatic stress disorder, or PTSD, is a condition characterized by severe anxiety, flashbacks and nightmares, etc., that are triggered by a traumatic event, such as SA or war experiences. Complex PTSD typically occurs in people who have repeatedly experienced very distressing situations, such as long-term abuse. Insomnia is difficulty falling asleep or staying asleep and can be short-term for less than 3 months, or long-term lasting much longer. Most cases can be resolved by changing sleeping habits, however more severe insomnia may need treatment like cognitive behavioural therapy. In recent times, doctors have become reluctant to prescribe sleeping pills due to the serious side effects and risks of dependency. If they are prescribed, it's only for very bad insomnia and for a short period of time. Tourette's syndrome usually begins during childhood and causes tics, which can be involuntary sounds such as whistling or saying random words, or movements like blinking and twitching. Symptoms usually improve as a person ages, but can get worse when they are tired or anxious. Bulimia is an eating disorder that is most common in teenagers aged 13 to 17. It causes a person to binge eat, then purge, meaning they eat a lot of food in a short space of time, then make themselves sick, and they often excessively exercise too in an attempt to not gain weight. The effects of this cycle include fatigue, dental problems, and damage to organs like the heart or kidneys. Anorexia is another eating disorder that is also more common in teenagers. It causes a person to become obsessed with their weight, resulting in them not eating enough and excessively exercising. They will often have a distorted image of themselves, believing they are overweight, even when they're seriously underweight. Symptoms of borderline personality disorder fall into four main categories: emotional instability, impulsive behaviour, cognitive distortions, and intense and unstable relationships. It can cause someone to abuse drugs and alcohol, develop an ED, and SH, or attempt to take their own lives, among other problems. Hypochondria is now more commonly referred to as health anxiety and is a condition related to OCD where a person excessively worries about having an illness or developing one, sometimes with no reason to believe that. I recently uploaded a video on a Reddit user who was suffering with health anxiety related to rabies. I'd recommend checking that out if you're interested in hearing about a specific example. Gender dysphoria is described as clinically significant distress that may occur in people whose gender identity is different from their biological sex. This can cause depression, anxiety, low self-esteem, substance misuse, and is likely to cause serious problems in someone's personal life, which may even result in them attempting to take their own life. Narcolepsy is a rare and incurable condition caused by a lack of hypocretin in the brain that causes people to suddenly fall asleep without warning, as well as experiencing sleep paralysis and loss of muscle control. Thankfully, no serious physical health problems arise from the condition, but for obvious reasons, it can have a major effect on a person's life. Pica is an eating disorder that involves craving and eating items that are not food, such as dirt, hair, and soap. Pica is most common in pregnant women, young children, and people with developmental disabilities, and it can also affect animals such as dogs and cats. There are many risks associated, such as damage to the digestive system, particularly when the objects being consumed are sharp or very solid, like rocks, and also infections, for example as a result of eating soil that is contaminated with animal feces or parasites. Imposter syndrome is a psychological phenomenon that involves feelings of self-doubt and incompetence, and a persistent internalized fear of being exposed as a fraud. Up to 70% of people will experience symptoms associated with it at some point in their lives, and it's often seen among high-achieving individuals, though it's not always work-related. It could occur in romantic and platonic relationships and other social interactions. Premenstrual dysphoric disorder, or PMDD, is a mood disorder that's similar to premenstrual syndrome, but much more serious. It causes emotional problems like severe anxiety, depression, and irritability, and also physical symptoms like headaches and bloating around a week before a woman starts her period, and symptoms usually stop a couple of days into the period. Antisocial personality disorder is a condition that is typically associated with psychopathy. It may cause a person to be manipulative, irresponsible, impulsive, and to lack empathy and remorse. People with the disorder are prone to criminal behaviour and have difficulty sustaining long-term relationships. There may be genetic factors involved, but traumatic childhood experiences are also thought to cause it. Selective mutism is an anxiety disorder that is associated with a phobia of certain social situations that prevents people from speaking. It usually begins in children between the age of 2 and 4 and can often be mistaken for a child just being rude or sulky. They may avoid eye contact, become tense, stubborn or aggressive, and be clingy towards people they are familiar with. Oppositional defiant disorder can cause a child or young person to be argumentative, quickly lose their temper, not listen to their parents, and deliberately try to annoy others. These behaviours are all relatively common in children, but if they're displaying them to an extreme extent, it could be indicative of ODD and may result in a child injuring themselves and occasionally others. A person who has narcissistic personality disorder will have an overly high sense of self-importance and superiority and will crave attention and admiration. The confidence tends to be a mask for insecurity and low self-worth though, meaning they can easily be affected by the slightest criticism. They may also lack empathy and the ability to understand other people, which can cause problems with relationships and work. The disorder cannot be cured, but treatment, such as psychotherapy, can help. Dissociative identity disorder, previously known as multiple personality disorder, causes a person to feel like they have several distinct identities, each having different names, voices, and behaviour, and it can also result in gaps in memory of personal information and daily events. There are various other associated symptoms, including depression, anxiety, panic attacks, mood swings, and hallucinations. While treatment can reduce symptoms and improve quality of life, there is no cure. Body dysmorphic disorder is characterized by excessive worrying about flaws in physical appearance, often things that aren't noticeable to other people, such as blemishes on the skin and asymmetry of features. It's more common in teenagers and young adults and can have a serious effect on daily life, as people with the disorder will often spend a lot of time and effort trying to conceal flaws, for example by spending an excessive amount of time applying makeup. Cognitive behavioural therapy is one of the most common treatments, particularly for milder symptoms, and antidepressants can be prescribed for moderate to severe cases. Trichotillomania is also known as hair-pulling disorder, and as the name suggests, it results in an uncontrollable urge to pull out hair, either from the head or other places like eyebrows, eyelashes, and beards. The condition is usually linked with anxiety, and a sense of relief will be felt when the hair is pulled out. Agoraphobia is often thought of as a fear of open spaces, but for most people it's much more complex and usually relates to a fear of not being able to escape a situation or get help if something goes wrong. It can be life-altering, as sufferers may avoid situations like travelling or even leaving their home, and can experience panic attacks when in such situations, or even just by thinking about them. Dysgraphia is a learning disability that affects the ability to write, including handwriting and spelling, and also the ability to hold a pen, as well as other similar tasks like cutting food and tying shoes. Explosive head syndrome is a type of sleep disorder that is often linked with sleep paralysis, causing the perception of loud noises and explosive crashing sounds in the head. There can also be visual symptoms too, such as flashes of light. Not much research has been conducted, so there is no solid evidence to support treatment, and while there are some theories, including minor seizures affecting the temporal lobe and ear dysfunctions, the cause of it isn't definitively clear. Dyscalculia, sometimes described as dyslexia with numbers, is a learning difficulty that makes it hard to understand and learn maths, as well as to perform other tasks such as reading clocks. Symptoms usually occur at a young age and tend to become more apparent as children get older. The term shell shock was coined during World War I to describe the symptoms experienced by soldiers who had become traumatized due to the things they'd seen or done during the war. It's now known as post-traumatic stress disorder, though PTSD can also occur after various other events not related to war. Symptoms are mostly the same though, such as anxiety, nightmares, and flashbacks. Pyromania can be defined as an uncontrollable impulse to deliberately start fires, either for a feeling of relief or gratification. It's very rare, and as a result, not much research has been conducted on it, but it is one of the more dangerous disorders on this iceberg, as if someone with it is unable to resist their urges, it directly results in them breaking the law, causing damage to objects or property, and perhaps even causing injury or death to themselves or others. Avoidance/restrictive food intake disorder, or ARFID, causes people to avoid certain foods or food groups and/or restrict the amount of food they eat. Unlike some other eating disorders, sufferers of ARFID are not necessarily concerned about their body weight, but more the taste, texture, and smell of certain foods, as well as worries related to eating in itself, such as the risk of choking or sickness. In severe cases, it can result in a person losing a significant amount of weight or becoming deficient in certain nutrients, which in turn can cause other serious health problems. Kleptomania is an impulse control disorder characterized by an inability to resist the urge to steal, even items that aren't needed. The stealing usually occurs after intrusive thoughts and is followed by a release of internal pressure, suggesting it could be seen as a specific type of OCD. People with the disorder may feel intense guilt after they steal, but this will not prevent them from doing it again. Madonna whore complex occurs in men who categorize women into two exclusive groups: perceived degraded women, who they desire strictly for intimate contact, the whores, and respectable women who they view as suitable long-term partners, the Madonnas. They don't want a relationship with the whore and don't become aroused by the Madonna. Sigmund Freud first identified this complex, though spoke about it as a psychic impotence, and wrote, "Where such men love, they have no desire, and where they desire, they cannot love." It goes without saying that this is rooted in misogynistic views, and it's also been suggested that it may be more common in men whose mothers were cold but overprotective, causing them, as adults, to seek a partner that fulfills their need for maternal intimacy that was not met in childhood, but resulting in repressed negative emotions, preventing arousal of that kind. Schizoid personality disorder can cause a person to appear odd or peculiar to others and involves detachment, apathy, lack of motivation, lack of interest in social relationships, and avoidance of social situations, leading to them typically having a solitary or sheltered lifestyle. It's more common in men than women, and factors that increase the risk of it developing include having a parent with the disorder or another related condition, and having parents who were cold and neglectful. Cognitive behavioural therapy can improve the condition, but many choose not to seek treatment because it would mean interacting with other people. Stockholm Syndrome occurs in cases of kidnapping where the victim develops feelings of trust, affection, and even empathy for their kidnapper. It can also emerge in abusive relationships and is reliant on a power imbalance. According to the FBI, around 8% of hostage victims show signs of the syndrome, but there is little research on it. In fact, some have disputed the legitimacy of it, and it's never been included in the Diagnostic and Statistical Manual of Mental Disorders. In a book on domestic violence, Jess Hill described the syndrome as a, quote, dubious pathology with no diagnostic criteria, and stated that it is, quote, riddled with misogyny and founded on a lie, highlighting that most diagnoses are made by the media, not psychologists or psychiatrists. The term God complex is self-explanatory. It's basically when an individual believes that they are a god. They have an extremely inflated sense of power, superiority, entitlement, and confidence in their own beliefs and opinions, often speaking of them as if they are unquestionably factual. This may cause them to expect special privileges and to not conform to societal norms. God complex is not a clinical term. People with it are diagnosed with narcissistic personality disorder. Histrionic personality disorder is characterized by a pattern of extreme attention-seeking behaviors. People with it will be very self-centered, suggestible, constantly seek reassurance and approval, and display dramatic and exaggerated emotions. It's more common in women than men, and causes include genetics and childhood trauma. Mass hysteria can be defined as an outbreak of unusual and uncharacteristic behaviours, thoughts and feelings, or health symptoms within a group of people. There are two different types: mass anxiety hysteria, involving symptoms of anxiety like chest pains, headaches and fainting, and mass motor hysteria, which affects movement and can produce symptoms like shaking, partial paralysis, altered speech, and unstoppable laughing or crying. There are various examples throughout history, one being the dancing plague of 1518, which began when one woman suddenly started dancing in the street. Within a short space of time, between 50 and 400 people followed suit, dancing for weeks. Some sources claim that around 15 people a day danced to their deaths in the plague, though this is disputed. An alternative theory to explain this, if it wasn't mass hysteria, is food poisoning caused by a toxic and psychoactive chemical product of ergot fungi, which grows on grains and is structurally similar to LSD. Avoidant personality disorder causes an individual to be incredibly shy, sensitive to rejection and criticism, easily frustrated, and to have trouble controlling their anger. They will typically feel lonely and inferior to others, which can cause them to avoid forming relationships and trying new activities. As the name suggests, paranoid personality disorder centers around paranoia, and people with it can become very isolated, as they will find it hard to trust others, even friends and family, meaning they seldom open up or confide in people, and also often believe that people are out to get them, or that situations are dangerous when they likely aren't. Delusional disorder used to be known as paranoid disorder, and some of the symptoms are similar to paranoid personality disorder. However, sufferers will also experience serious psychosis, meaning they can't tell the difference between reality and delusions. There are various different types, such as erotomanic, which is where they will believe someone, often a celebrity, is in love with them. Somatic, which causes them to believe they have a medical problem or other physical issue. And jealous, which involves them believing their partner is cheating on them without evidence. It's also possible to have mixed delusional disorder involving two or more different types. It affects around 0.05 to 0.1% of the population and is more common in people who are socially isolated, for example those who are deaf or elderly. Agnosia is a neurological disorder that usually occurs after a brain injury or illness. It prevents people from processing sensory information, meaning a loss of ability to recognize objects, people, sounds, and smells, even though there are no problems with the senses or memory loss. It's very difficult to treat agnosia itself, and doctors will usually focus on treating whatever condition has caused it in the first place. Olfactory reference syndrome is a psychiatric condition that causes people to falsely believe and become obsessed with the idea that they are emitting a foul and offensive body odour. It can either develop gradually or suddenly occur following a specific event, and while treatment is attempted with therapy, antidepressants and antipsychotics, there's little evidence to suggest they work, likely because the condition is so rare. A persecution complex is an irrational and obsessive fear that others are trying to cause harm and oppress you. It can be classed as a type of delusional disorder and usually affects people or groups whose beliefs and ways of life are relatively widespread, such as Christians. Napoleon complex is also known as short man syndrome and describes a phenomenon where people who are short in height attempt to overcompensate for it by being more aggressive, assertive, and dominant. It's not an official diagnosis, but rather a stereotype, and some research has failed to find a link between short height and those characteristics. Fatal familial insomnia is a very rare and severe type of insomnia that is genetic. Symptoms are progressive and they usually appear at around the age of 45 to 50, preventing sufferers from sleeping, which causes brain damage and eventually death. The period of time leading up to death is often unimaginably distressing, involving symptoms such as muscle spasms, rapid heart rate, speech and memory problems, double vision, and loss of coordination. Capgras delusion, sometimes referred to as the delusion of doubles, causes a person to believe that someone close to them, a friend or family member, or a pet, or even an object, has been replaced by an identical imposter. This can result in them becoming violent towards the imposter and trying to find the real person that they believe has been replaced. It's most common in people who have paranoid schizophrenia, as well as those who have a brain injury or dementia. Alien hand syndrome is characterized by involuntary limb movement, as if the limb has a mind of its own, usually the left hand, but it can also affect the other hand or the legs. Someone with this condition may not even realize their limb is moving until someone else notifies them, or it does something that draws their attention to it. There is no cure, which is scary because some have reported that their alien hand has attempted to harm them or others. Folie à deux, which translates from French as madness for two, is also known as shared psychosis and shared delusional disorder. It describes a mental illness or delusion that is shared by two people who are close to each other. One of the most well-known cases of this involved Swedish twin sisters Ursula and Sabina Eriksson. Ursula ran into the road in front of a lorry and her sister followed right after. They both sustained serious injuries but survived. Although it was initially believed that Ursula was the primary sufferer and Sabina was influenced by her, when they were released from hospital, Sabina ended up stabbing a man to death. Lima syndrome is the opposite of Stockholm syndrome and describes a phenomenon where the kidnapper feels sympathy for the victim and forms a positive connection with them. The term was coined in 1996 after a group of terrorists who were holding a number of people hostage in Lima, Peru, decided to release most of them because they felt sorry for them. Somatoparaphrenia is a delusional belief that causes a person to feel like a paralyzed limb does not belong to their body, to the point that they will totally deny ownership of it. Even when provided with undeniable proof that the limb belongs to them, they will come up with elaborate stories to explain how it ended up on their body, sometimes claiming it belongs to someone else. When looking in a mirror, they may be able to acknowledge that the limb is theirs, but as soon as the mirror is removed, they begin denying it again. Oedipus complex is a theory proposed by Sigmund Freud, who believed that during childhood, boys unconsciously want to have inappropriate contact with their mothers, and that they are envious and hateful of their fathers because of that. He claimed it usually arises during the phallic stage of psychosexual development between the ages of 3 and 6, during the formation of the libido and the ego. The theory claims that boys at this age will suffer with castration anxiety, an irrational fear that their father will castrate them. Carl Jung later coined the term Electra complex to describe a similar phenomenon in girls, where they compete with their mother for their father's love. According to this theory, girls have penis envy. Both theories have been highly disputed, as there's little evidence to back them up. Rumination syndrome is characterized by an involuntary regurgitation of food. It's a learned behavior, not a physical issue, but it can be triggered by physical illness or injury or stress. Medication doesn't usually help, and behavioral therapies are usually recommended instead. The symptoms of Alice in Wonderland syndrome include misperception of one's own body and other objects relating to their size. For example, they look and feel bigger or smaller than they are. Changes in appearance of objects, for example straight lines can look wavy and skewed, and disruption in sense of time. Perhaps most worryingly, it can cause you to feel like you're split in two, that each half of your body exists separately. The causes of this syndrome aren't totally clear, but it could be caused by degenerative brain diseases, strokes, conditions like epilepsy, and recreational drugs. Anton Babinski syndrome is a delusion that causes people who are cortically blind to deny their blindness, wholeheartedly believing and adamantly insisting that they can see. Despite bumping into objects and describing objects that aren't there, they attempt to explain this in a convoluted way, for example by blaming poor lighting and other factors. There have only ever been 28 confirmed cases, and these have usually occurred in adults, though a case study of a 6-year-old boy was examined in 2007 who had abnormal eye movements, would fall often, and would reach for objects and miss, though seemed oblivious to his lack of sight. Charles Bonnet syndrome is another condition affecting people who are blind or with impaired vision, for example as a result of cataracts, but this one causes them to hallucinate. These hallucinations can be simple patterns, shapes and lines, or complex images, which would be so much scarier, like people, landscapes, animals, insects and other objects. This is not a mental illness, and people with it are aware that the hallucinations are not real. Reduplicative paramnesia can be defined as the delusional belief that a place or location has been duplicated, or that it has relocated to another site. This condition was first reported by Charles Bonnet, who also discovered the syndrome in the last entry. Sufferers will often believe that they are at home or somewhere else they're familiar with, when they're actually in a totally different place. For example, a case study covered by Frank Benson described a patient who had fallen in their home, causing a fractured skull and frontal lobe damage. He was well aware that he was in the Jamaica Plain Veterans Hospital in Boston, but he insisted that the hospital was located in his hometown in Massachusetts. Later, he even became convinced that the hospital was located in the spare bedroom of his house. Syndrome of subjective doubles is basically what it sounds like, a delusion that causes a person to believe they have one or more doppelgangers who are physically identical to them but have a different personality and are leading lives of their own. Sometimes they will think that the doppelganger is someone they know or a complete stranger. It's very rare and usually accompanies another mental disorder involving psychotic hallucinations, such as schizophrenia or bipolar. Mirrored self-misidentification is the delusional belief that one's reflection in the mirror is another person who is following them around, usually a relative or stranger, but it can also be a younger or alternative version of oneself. It's somewhat common in people who have dementia and is caused by impairment in the right hemisphere of the brain, usually combined with damage in other areas, for example the right frontal lobe. Akinetic mutism is characterized by an inability to move or speak, as if stuck inside the shell of a body. It's usually a symptom of diseases like meningitis and Creutzfeldt-Jakob disease, but can also be caused by trauma, tumours and cysts on the brain. Depending on the cause, it can be treated with varying levels of success, for example by draining a cyst, though symptoms are likely to reappear if the cyst fills up again. Some diseases that result in it are not curable, like Creutzfeldt-Jakob disease. Catatonia is a behavioural syndrome typically seen in people with schizophrenia and mood disorders that results in abnormal behaviour and movements, immobility and withdrawal. The three main types are withdrawn catatonia, which causes a lack of response to external stimuli, meaning people may sit or stand in unusual positions for hours, barely moving. Excited catatonia results in hyperactivity, odd mannerisms, restlessness, and sometimes delusions and hallucinations. The most terrifying type is malignant catatonia, which is life-threatening and progresses rapidly, causing fever, sweating, high blood pressure, rapid heart rate, and delirium. The term Jonah complex was inspired by the biblical story of Jonah, who initially refused to fulfill his prophetic mission due to fear. The complex can be defined as a fear of success, the responsibilities that come with it, and the chance of not being able to sustain it, causing people to self-sabotage and avoid opportunities and challenges, like interviews, auditions, moving home, and getting married. Ganser syndrome is a rare dissociative disorder that is characterized by symptoms like confusion, amnesia, lack of concentration, and clouded consciousness, sometimes resulting in behaviors like approximate, bizarre, and nonsensical responses to simple questions. For example, if asked how many legs a dog has, someone may answer with 6. The cause of it isn't always clear, but it's thought to be linked with trauma and substance abuse, and can sometimes be treated by addressing these problems. It's a relatively controversial syndrome because it is most common in prison inmates and is sometimes seen as an attempt to gain leniency from prison staff, judges, or juries. Cotard syndrome, also known as walking corpse syndrome, is a rare mental illness most common in people with severe depression or bipolar, causing them to believe that they are dead or do not exist, or that their organs are decaying or missing. One example of this is the case of Mademoiselle X, a woman who believed parts of her body didn't exist and was convinced that she didn't need to eat. She claimed she could not die a natural death, but sadly ended up dying of starvation because she refused to eat. Treatment can include drugs like antidepressants and antipsychotics, but it's thought that electroconvulsive therapy can be more effective. Free-Goalie delusion is a type of delusional misidentification syndrome, like Capgras and subjective doubles, which we already covered. It causes sufferers to think that a stranger is actually a familiar person in disguise, or that multiple different people are actually the same person in disguise, or that they have shapeshifted, and in many cases that this person is stalking them, leading to paranoia, inaccurate memory of places, objects, and events, and lack of self-awareness. People with Munchausen syndrome, also known as factitious disorder, will intentionally fake symptoms of physical or psychological illnesses to gain sympathy and attention. In some cases, they will actually induce illness and cause harm to themselves to make it seem more believable. It can be life-threatening, as they often won't realise at what point they're going too far. I uploaded a video a couple of years ago about a woman whose descent into this illness caused her to need her legs amputating because of damage she'd caused herself, all while claiming she was suffering with conditions that were not her fault. She documented it online under the username Differentially Kelly. I'll leave a link to this video in the description if you want to check it out. Delusional parasitosis causes an individual to falsely believe that they are infested with parasites such as mites, fleas, lice, worms, and spiders without any evidence to suggest that. It can lead to compulsive behaviours like picking at the skin, obsessive self-examination, and visiting various doctors when one fails to find evidence of any infestation. It can be difficult to treat because they might reject psychiatric help, believing they are not delusional and that their infestation will become worse if not treated as a physical condition. Jerusalem syndrome occurs in people who visit Jerusalem and causes them to experience religious or spiritual delusions and hallucinations. It's not listed as a recognised condition in the DSM because many believe it's simply a re-expression of a previously existing psychotic illness, though there are cases in people with no history of mental illness. There are various other syndromes that are related to specific cities or places, another example being Paris syndrome, caused by the extreme disappointment that some people experience when they visit Paris and it's not what they expected. This can cause anxiety, hallucinations, depersonalization, and physical symptoms like dizziness, sweating, and even vomiting. Messiah complex is a term used to describe individuals who believe they are destined to save the world or a particular group of people. Similar to the God complex, it can cause a delusional sense of superiority and self-importance, but there is a focus on helping others and sacrificing one's own needs to do so. Intermetamorphosis is a delusional disorder that causes someone to believe they or other people are transforming into another person or being. They might start falsely noticing changes in their physical appearance and experiencing sensations of metamorphosis. This can result in social isolation due to fear of judgment and rejection, with some believing those close to them will not want to know them once they have transformed, and in cases where they think other people are transforming, they can become aggressive towards them. Treatment can include antipsychotic medication and cognitive behavioural therapy, but sufferers will often be quite resistant to treatment because they genuinely believe their delusions are real. Stendhal syndrome, or Florence syndrome, is a psychosomatic disorder occurring in individuals who experience symptoms like dizziness, heart palpitations, fainting, confusion, and even hallucinations after becoming enthralled by a piece of art, music, or literature. The condition is named after a French writer who experienced such symptoms while visiting Florence. Like Jerusalem or Paris syndrome, it is associated with Florence specifically, as there isn't much evidence of cases occurring elsewhere. In cases where there are underlying psychological issues, addressing these may relieve symptoms, but the syndrome usually resolves itself in a relatively short space of time, when the individual is no longer around the art that triggered it in the first place. Diogenes syndrome is the name of the condition that hoarders have, causing them to accumulate excessive amounts of possessions, clutter, and garbage in their homes, which can be very dangerous as it means they have unsanitary living conditions, and it can pose a higher risk of fire and the potential for more serious consequences as a result of fire, as the items will feed the fire and make it harder to escape the house. The syndrome can also result in neglect of personal hygiene and self-care, which increases the risk of physical illness. People with it will rarely seek help and deny that they are living in poor and unsafe conditions. Shockingly, research shows that approximately half of the patients admitted to hospital for treatment die while there. Boanthropy is a rare disorder that causes one to believe that they have transformed into a bovine animal, causing them to start acting like an animal, walking on all fours and eating grass, for example, and to avoid or struggle to communicate with others. Treatment can involve a combination of antipsychotic medication and psychotherapy. This is a type of clinical lycanthropy, which is a general term for people who think they have transformed into any animal, not just cows or bulls. Phaedra complex is characterised by an intense and irrational attraction to stepchildren. It's a subtype of incestuous fixation, but is not recognised as a condition in the DSM. You might not really think of animals experiencing mental illnesses like humans, but there is evidence to suggest they exhibit behaviours similar to humans who have a mental illness, including symptoms of anxiety, depression, and post-traumatic stress disorder. Some studies have even found that animals may suffer with psychotic conditions like schizophrenia, but of course there's no way to know for sure, so this is a topic of much debate. I'm not a doctor or a vet, but it kinda makes sense to me that animals would suffer similar psychological conditions to humans, as they have some of the same hormones and neurotransmitters, and there are other anatomical similarities too. They can suffer with many of the same physical conditions, so why not psychological too? Though of course, animals don't have the same level of consciousness as humans, so their conditions are unlikely to be quite so complex, and it's unlikely that they could experience every single one of the illnesses that humans do. Diagnosing mental illness in animals is incredibly difficult because they can't explain their thoughts, feelings, and experiences, so diagnosis is usually solely focused on observation. Truman syndrome is a delusional disorder that causes people to believe that their lives are staged reality shows or that they're constantly being filmed, like in the plot of the movie The Truman Show. An example of this is the case of an army veteran who believed that climbing the Statue of Liberty would release him from the show. Here's how he described his condition. I realised that I was, and am, the centre, the focus of attention by millions and millions of people. My family and everyone I knew was and are actors in a script, a charade whose entire purpose is to make me the focus of the world's attention. Autophagia is characterised by a compulsion to self-mutilate by biting or chewing on one's own body parts, including nails, hair and fingers. In severe cases, this can lead to infections and even amputation. It may be related to the desire to seek pain, and it also occurs in animals, though perhaps for different reasons. It's not officially recognised as a condition in the DSM, so there is no universally recognised method of diagnosis, and treatment can be difficult, but usually centres around behavioural and environmental modification, for example wearing gloves to discourage biting the fingers. Autophagia is kind of similar to autocannibalism, though people with that will eat parts of them, such as scabs, nails and hair. Renfield syndrome, also known as clinical vampirism, is a rare condition related to an uncontrollable obsession with drinking blood, causing sufferers to injure themselves and occasionally others, then suck the blood. They also wouldn't be opposed to drinking blood from a dead body. It can occur alongside other psychological problems like psychosis, hallucinations, and delusions, and is likely to be misdiagnosed because there is such little research on the condition. To treat it, hospitalisation is usually necessary, so the patient can be monitored 24/7 to prevent them harming themselves or others, and antipsychotic drugs combined with psychotherapy can be effective. Symptoms of Kluver-Bucy syndrome include compulsive eating and eating unusual objects, hypersexuality, docility, and visual agnosia, meaning impaired recognition of objects. It's actually more common in rhesus monkeys than humans and is incurable, so treatment usually focuses on alleviation of symptoms. Pathology on the syndrome is relatively controversial because it's extremely rare for humans to present all symptoms associated with it, but it can be associated with conditions like Alzheimer's, Pick's disease, and Rett syndrome, as well as damage to the temporal lobes of the brain. Body integrity dysmorphia causes individuals to want to have a sensory or physical disability, usually related to the desire to amputate a totally healthy limb, to become paralysed, or to become blind or deaf. People with this condition sometimes compare it to being transgender and refer to themselves as transabled. They might pretend to be disabled, for example by using a wheelchair or pretending to be deaf or blind. There have allegedly been a few rare cases of people either amputating their own limbs, allowing significant damage that will force a surgeon to amputate them, or causing other serious damage to render themselves disabled. One example is Roland Bowen, who amputated his own right leg below the knee in his bathtub, using a hacksaw, hammer and chisel. Another is the case of a woman who blinded herself with drain cleaner. The condition is more common in men, and interestingly, there seems to be a correlation between its presence and the presence of a paraphilia. Martyr complex can be thought of as a kind of victim mentality. People with it will often be talking about how bad their lives are, even exaggerating bad things that happen to them, as well as highlighting sacrifices they've made for other people to get sympathy. They believe they are constantly being treated unfairly, persecuted and taken advantage of, which can lead to feelings of anger and resentment. Treatment is usually offered in the form of therapy, such as cognitive behavioural therapy. We covered Munchausen syndrome earlier in the Iceberg, and Munchausen by proxy is basically that, but rather than an individual faking their own symptoms, A parent or caregiver, etc., will fake symptoms in their child or someone they take care of, and in some cases will actually make them ill in order to gain attention and sympathy and to make themselves look like heroes for caring for the allegedly sick person. Perhaps the most well-known example of this was the case of Gypsy Rose Blanchard, whose mother, Dee Dee, claimed had a variety of chronic conditions, including leukemia, muscular dystrophy, and asthma. She attributed numerous conditions to an unspecified chromosomal disorder and claimed that Gypsy had brain damage that meant she had the mental capacity of a 7-year-old when she was a teenager. She also not only lied about her daughter's age to other people, but made Gypsy herself believe she was 14 when she was actually 18. Around 2012, Gypsy began talking to a man online, Nicholas Godejohn, and developed a relationship with him. Eventually, after meeting him in person, the two began planning to kill Dee Dee, and in June 2015, Gypsy let Nicholas into her home so he could stab her mother to death. Her body was found by police sometime after, and when it became clear who was responsible, Gypsy and Nicholas were arrested and eventually convicted of the murder. I'd be interested to hear your thoughts in the comments, particularly if you or anyone you know suffers with any of these conditions. If you enjoyed the video, please consider liking and subscribing. Huge thank you to my Ko-fi members and channel members whose names are on screen now. I really appreciate your support. Thanks for watching, and I'll see you next Thursday in a new video.